Good afternoon. I'd like to call to order the Health and Human Services and Aging Committee. Today is Wednesday, July 28th, 2021. Can we have a roll call, please?
Good afternoon. It is now 1:06 p.m. Calling the roll for the July 28th, 2021 Health and Human Services and Aging meeting. Ms. Conwell,
Present.
Mr. Sweeney,
Present.
Ms. Brown,
Here.
Mr. Miller,
Present.
Ms. Stevens. Ms. Stevens will be joining us shortly. You have a quorum.
Thank you. Madam Clerk, has anyone signed in for public comment?
No, Ms. Chair, no one has submitted public comment.
Approval of the minutes from the June 30th, 2021 meeting. Can I have a motion and a second, please?
Move approval.
Moved by Sweeney, seconded by Miller. All in favor, please say aye.
Aye.
We have, I believe, 3 items that are referred to the committee today. Just in case I forget, in terms of mentioning it at the end of the meeting, we are planning in mid-September, or the next time that this committee meets, we will bring forth from the administration or from HHS kind of a homeless plan of what's going on in terms of the homeless youth, our women in our community, as well as our males. So just in case I forget that. Who is here to speak to the first item? And Madam Clerk, if you could please read it into the record, please.
Resolution 2021-0179, making awards on requisition 5074 to various providers in the total amount not to exceed $1,575,000. For emergency assistance services for the period September 1st, 2021 through August 31st, 2022 for the vendors as listed on the printed agenda, items A through E.
Good afternoon, Madam Chair. David Merriman, Director of the Department of Public Health. Department of Health and Human Services. Thinking of public health these days. Before we jump into this specific item, I do want to recognize we have 3 items today. We have the directors here for the second and third item. Unfortunately, Director Weiss-Kettle wasn't available at this time, so I'll be representing DCFS with Paul Porter, who managed the procurement, and Chris Cabot, who is the Deputy Director for DCFS that's over this area. If I could, because there are a lot of guests here today, I do want to recognize for our guests, as your item is completed, you're welcome to stay. It's a public meeting, but I would also just let you know that after your item, if you want to leave, you're welcome to leave. And one other point, I do also recognize there could be confusion that some people wear masks and some don't. So I would say again to our guests, county policy is that county employees can be unmasked if they have vaccinated and turned in their cards. Unfortunately, our guests need to have a mask on. And so I'd ask, if you're a guest, you maintain use of a mask, although I do understand it's okay to bring down a mask if you have to speak. Is that accurate?
Yes.
Okay. So first item here is a contract with a number of vendors to provide emergency services. I'm going to invite Paul Porter up to talk about the item along with Chris Cabot. I do want to just recognize that this item is scheduled. Actually, if but for the recess, this item would be approved way in advance of its start date. Unfortunately, given the recess, I do think the department will be asking for passage of this item and the other items presented today in second reading suspension. But DCAP did a great job bringing this one in way ahead of time, if but for the recess. Paul.
Thanks, David. Afternoon, council members. As David indicated, this is a new contract for emergency assistance services, which is operated through the Division of Children and Family Services. It's a master agreement with a 1-year value of $1,575,000. This contract does have 2 option years that would occur in 1-year increments following the 8/31/22 expiration of this 1-year term. Those option years were included in the RFP. I will note that the five vendors listed here, A to Z Furniture Company, Burlington Stores, Dave's Supermarket, J.C. Penney and West 25th Furnishings and Appliances are all current vendors, and they were the 5 respondents to this RFP. So we are making an award to every entity that submitted a proposal. That 1-year value is the same as the value for the contract that expires on 8/31 of this year. And I did talk to DCFS a little bit about the utilization of this contract. Like many of our services, utilization during the pandemic has looked a little bit different than it did pre-pandemic. So this is one where, for the first 6 months of the year, we might expect something in like the $775,000 range if they were at 100% utilization through 6 months. We're seeing something more along the lines of $475,000. So it's below what, is budgeted in the contract. I will note that the contract amount is a not to exceed value though. So we pay the providers based on the actual services delivered and what they invoice us based on. We're not obligated to pay the full $1,575,000 depending on utilization. There may be many factors that have impacted utilization during the pandemic. Part of it is that referrals to the Division of Children and Family Services were generally lower during the pandemic than pre-pandemic. One of the other factors with this service in particular, the emergency food, furniture, and clothing, is that direct aid from the government from the federal government might have enabled people who otherwise would access these funds to spend those dollars on things like food, furniture, and clothing instead of relying on these emergency funds. I think that's kind of all. I'd like to highlight which vendors provide what services, although their names are fairly self-explanatory on the agenda. So A to Z Furniture and West 25th Furnishings and Appliances are the 2 vendors that will provide furniture and appliances when needed under this contract. J.C. Penney and Burlington are our 2 vendors for clothing services, and Dave's Supermarket is our vendor for emergency food. I will note that the last time around, when this was RFP'd a few years ago, we didn't get respondents for clothing direct to the RFP, so we ended up doing a reissue of that RFP, and J.C. Penney responded. Due to capacity issues and some of the store closures that they've had over the past several years, we sought an additional vendor through an alt procurement at the end of last year, and that's how we ended up contracting with Burlington. Now I'm pleased that everybody responded to this RFP, so we're able to make one award to all of the vendors on the same RFP instead of having to seek out additional vendors. I'll invite Chris Cabot, one of the deputies at the Division of Children and Family Services, up in case you have any programmatic questions, and I'm happy to address any questions related to the procurement process and the contract itself.
Okay, I'd like to let the record reflect that Councilwoman Stevens is in attendance. I have a question in regards to, were there any funds not utilized from the last contract?
Based on the dollar amount, Councilwoman Conwell, that we're seeing for the partial year expenditures, it looks like there likely will be some funds that are unused at the end of that contract. And it's funding-wise, those funds, because the current contract is a not-to-exceed dollar amount, if those remain unexpended, they could be used for other purposes. It's not like we have to spend a certain amount of money on this service alone.
And this contract is basically for the Department of Children and Family Services. Does the Employment and Family Services utilize this in any way?
No, this contract, Councilwoman Conwell, is just for the Division of Children and Family Services. I know specific to senior and adult services, for instance, they have their own process for kind of the emergency expenditures. Because this contract is directly managed through DCFS and they handle kind of the vouchering and sending clients to the specific vendors, this one's just kept in-house for DCFS.
All right, thank you. I'd like to open up the questions to my colleagues. Councilman Sweeney,
Thank you,
then
Madam
Miller.
Chairwoman, and my colleagues. Welcome. Just a couple questions, or more of a request. Just how is somebody eligible to participate in this? And that's a phone call after, if anybody just to take the time to go over it with me, so I don't need an answer now, but if you'd reach out, I'd be very much appreciative. Through the chair, just on the funding, not to exceed is a dollar amount for all three of them, so that you'll knock out this answer. When you answer this question, you'll knock out three questions that are the same. We have the dollar amount. Do you divide it up after you have the dollar amount, or do you make the awards and that equals the not to exceed?
Thank you, Councilman Sweeney. So if you look in the agenda, there are initial dollar values written for each vendor.
And that adds up to the not to exceed.
Exactly, but because this is a master agreement, if we see that, one vendor has a higher level of invoices than another vendor, doing a master agreement allows us to move dollars around within that contract without having to do a formal amendment. So if we notice that we're spending more on furniture than what we anticipated and less on clothing, we could do kind of, administrative paperwork to shift funds around. This is just, kind of our initial allocation for those vendors, if you will.
Thank you for explaining that, Madam Chairwoman. So it's, you come up with a not to exceed dollar amount, then you ballpark it to the best of your ability and still have the flexibility to move the amounts or the dollars within the 5 different entities, and through the next 3 are the same way, right?
Absolutely. And I would note that we worked with both the program side at DCFS as well as their fiscal team to analyze kind of expenditures over not just the past year, but what things looked like pre-COVID to come up with those allocations.
Thank you for giving me a better understanding, and thank you, Madam Chairwoman, for allowing me to ask the question.
Thank you. Councilman Miller.
Madam Chair, to Mr. Porter, did we have more providers apply other than the 5 that were awarded?
Thank you, Councilman Miller. At this time, we're making an award to all 5 of the vendors that submitted proposals. Nobody else submitted a proposal and was not awarded.
Okay, and just a comment that it's really good to have 2 clothing vendors. As this has been a challenging area in the past, this gives you more flexibility and confidence going forward.
Yeah, thank you for that, Councilman. One of the reasons why it's really nice to have 2 is because of, like you said, of the localities of the stores make it easier for some of our clients to get to. As we know, JCPenney's has a limited amount of stores, where Burlington has quite a few in, the greater Cleveland and Akron area that makes accessibility to our clients a lot easier. So it's really nice to have and JCPenney's also has offered us some online shopping for those that need it as well. So the flexibility for our clientele has been excellent with both vendors.
Okay, thank you.
I have another question. During the pandemic, which areas which areas of need were needed the greatest?
Thank you for the question, Councilwoman. All across the board, the need was down. I think that what we saw was probably food being underutilized, or not, I shouldn't say underutilized, but the least amount of need there. I'm not exactly sure why. Like Mr. Porter said earlier, just the amount of calls and referrals for agency at the front door was significantly down during the pandemic. And a lot of the times, we can sort of keep families and children from going deeper into the system by providing some of these emergency funds. And a lot of times that's food. And there's also, at times other sources for furniture and clothing that we can use. But the food was the one that was down, I would say, just because of the sheer number of calls that we weren't getting. Typically, with the kids being out of school, and educators being one of our highest referral sources, things like that. We were just down on numbers of families that were being serviced.
Mr. Cabot, can you please speak directly into the microphone so we can hear you clear? Thank you.
Yes.
Then the need could have been offsetted by Cleveland Food Bank or other, do you think that's a possibility?
Yes, the need could have been offset by Cleveland Food Bank, but as I said, I think that, I mean, typically, in a year, gift cards is one of the things that we really have to monitor, and we have a lot of guidelines set in place to ensure that we can ration those throughout the entire year. But food cards, running low on food cards was not an issue this year, like I said, and we still actually had some carryover based on the lack of utilization. So yes, we do like to utilize our food banks and other sources and food pantries that we have, but our availability to provide the Dave's gift cards was never an issue during the pandemic, or actually in the start of this year.
So that's basically how we distribute, is when, based on the calls in requesting need or assistance.
Well, no, the calls typically aren't just because of a lack of food, but that might be something that we would find would be one of the stressors on the family or one of the issues the family's facing, so that we would, address that issue as part of the bigger picture. So, I mean, yes, do we get calls because kids or families are, begging for food or going door to door looking for food? Yes, we do. But that's not the only way that we, identify that as a need.
Any other questions from my colleagues? Hearing none. Anything else that you two gentlemen would like to share in regards to this contract?
Thank you, Councilwoman Conwell. I don't think we have anything else at this time.
All right, and I heard that there's possibility you want second reading suspension?
If we could, please, that way this can be approved prior to the 9/1 start date.
Okay, can I have a motion to move this to the full council under second reading suspension and a
So
second?
moved. Second.
Okay. Moved by Stevens and seconded by Miller. All in favor, please say aye.
Aye.
Madam Clerk, thank you for the break. Can you please read the next item into the record, please?
Resolution 2021-0180, authorizing amendments to contracts with various providers for the Propel Cuyahoga Workforce Services Program. It's for the period July 1st, 2019 through June 30th, 2021, to extend the time period to June 30th, 2022, and for additional funds in the amount not to exceed $7,309,902.78 for a contract with the Centers for Families and Children, and B, contract with Maximus Human Services, Inc.
Good afternoon. Paul Porter, Health and Human Services, on behalf of Cuyahoga Job and Family Services for this item. This is an amendment to our two contracts under the Propel Cuyahoga Workforce Services Program. We have separate contracts with the Centers for Families and Children and with Maximus Human Services. Those contracts were entered into as part of an RFP that was issued a couple years ago. We're exercising the final option year for those contracts, and we're looking to do another RFP for contracts that'll start in July of 2022. As noted on the agenda, the dollar amounts for both vendors differ, and these are different dollar amounts than what the initial contract as well as the amendment in 2020 were. This is a contract that we took a lot of time both last year and this year trying to right-size and modify in order to meet the needs of individuals seeking this kind of service in Cuyahoga County during the pandemic. So I will note that we are looking at an overall increase in funding for both vendors compared to what their funding was during 2020 and 2021 for the period from 7/1/20 to 6/30/21. For instance, Maximus's amendment this year is for approximately 2.9 million, and last year their one-year extension was for approximately 2.6 million. For the centers, their amendment last year was approximately 2.9 million, and for this year, it's a total of approximately 4.4 million. That does reflect that there are differences in the number of clients served by both agencies. And for a bit more of a programmatic discussion, I'd like to invite Kevin Gowan, the Director of Cuyahoga Job and Family Services, as well as Paul Bounds, the Deputy Director, who oversees this particular area for Cuyahoga Job and Family Services, in case there are any non-contract questions that you'd like to ask them. Additionally, we are joined by staff members from both agencies, the centers and Maximus, and we can have them introduced after your questions if you'd like to ask them anything.
All right, anything you'd like to share, Director?
As Mr. Porter, thank you, Chairwoman. As Mr. Porter indicated, is the third-year option. Both vendors have done an excellent job of responding to the pandemic and adapting to the very strange circumstances we have all found ourselves in the past year and a half. And we're trying to, at this point, expand and increase participation in our programs as we come out of this pandemic. And part of the contract is also this third amendment is, second amendment, is trying to do that. So we're very happy with their process so far, and particularly with their ability to adapt.
And I remember there used to be several vendors in the Workforce Services Program, and I remember the list going down. I think Esperanza might have been one, something with a V. I thought there were still 3. So I might have missed one.
The vendors, I'm sorry, there have always been 2 vendors as part of this contract. There's another Workforce Services that's under the SNAP program, and yes, that's probably what you're thinking of. That one was expanded recently.
The increase in participation so our numbers are down based on the pandemic?
Yes, largely so, yes.
Okay, is that during the pandemic, we didn't have any in-house meetings? Did we go virtual or?
There were a couple of things that affected participation during the pandemic. The 2 things that I would point to are, I will actually name 3. The virtual nature of things, they had to adapt to that. The lack of available participation sites, jobs just weren't bringing on new people at this time. And then the third thing that I would point to, I had it in my head, hold one second, I apologize, is the state and the federal government relaxed a lot of their conditions around these programs. So this program in particular, TANF, is part of work requirements at the federal level. While they did not remove the requirement, they were relaxed the enforcement of it. And as a response to the pandemic, Cuyahoga County JFS was granting good cause to the majority of the population in that we would rather people stay home and stay safe than force them into a work environment that people weren't comfortable with. So those 3 factors did affect participation.
And how did we notify the individuals that needed these?
I'm sorry, Councilman Cohen.
How did we notify the individuals that were signed up for these workforce?
How do we notify
About
them?
the changes and the lack of?
So we reached out to them when they become eligible for programs. We reached out to them initially at the start of the pandemic. We actually did a campaign to reach out to them via email and by phone to let them know what adjustments were being made. That was back in March of 2020.
Open up questions to any of my colleagues. Councilman Miller?
So, Madam Chair, Director, how did we determine the large increase for the Centers for Families and Children from something like 2.9 million to 4.4. How was that determined?
Do you want to address? Go ahead.
Thank you, Councilman Miller. When we looked at the referral numbers last year, and as Director Gowan mentioned, the number of individuals that were able to be placed at sites, some of which weren't accepting folks for employment, the dollar amount went down dramatically last year due to lack of kind of those available placements. And this contract is one of a handful in the county that has incentive-based payments included in it. The trouble with, having an incentive-based payment in an environment where it's not possible to meet that target through no fault of the vendors was that we had to make major modifications to the contract last time around to try to ensure that they were still eligible for some payment if they were able to serve, a lower number of clients, or even if the number of referrals was the same, but they weren't able to place as many clients. We wanted to ensure that they were still able to operate as a program because people were still seeking these services. The increase is reflective of the fact that we anticipate throughout this remaining year of the contract period, there will be many more opportunities for placement. And some of the incentives that we look at are initial placements. They're also related to the dollar amounts the individuals earn. And then there's retention payments as well. So you might get a payment for the initial placement of the client, but then if they stay there 6 months, for instance, you might be able to get an additional payment on top of that. It's a lot harder to do those kind of payments if there aren't, job sites accepting clients, though. So that's the major reason for the difference. Is there anything you would add?
No, it didn't.
And Madam Chair, Director, am I correct that this is not a master contract, and for the next RFP, are you planning to do separate contracts or do a master contract?
I'll start, and Mr. Porter can interrupt me. The intent is to do an RFP for, as Paul mentioned at the beginning of the presentation, for July 1st, 2022. And we'll be looking at the performance over the past 3 years, looking at how services were met, and determine if we should change the RFP. We most likely make changes to the RFP moving forward. We will be, in terms of whether or not that will be a master contract. I don't know, Paul, you want to?
Sure. So this one is a separate contract for, I think, a couple of different reasons. Part of that was, since this was a newer program, when the vendors submitted their proposals, we asked them to really help us design how their program would look. Some of the RFPs that HHS issues that this committee is familiar with, things like out-of-home care for DCFS and options for DSAS, we're fairly prescriptive within those RFPs in that we tell the vendors what we're looking for and essentially give them like a set of metrics that they have to meet to deliver that service. Since this was new, we didn't have kind of that level of specificity. As a result, the proposals we got were different enough that we entered into 2 separate agreements. It may be the case that as a result of changes to the RFP, we're able to be a bit more prescriptive and identify, what worked, what didn't work this time around. And I would say if it's an RFP that looks like that and paints more of a picture for the vendors, and they're essentially telling us, yes, we can do that, or no, we can't, that might lend itself to a master agreement more than trying to fit 2 very different proposals together into one master agreement. Does that make sense?
It does. And so could you say how long is it typical to work with an individual client, and could you provide a description of what the services are that are typically provided?
I'm going to ask my deputy administrator, the GFS deputy administrator, Paul Bounds, who's over the program, to come up and talk to council a little bit about that. Thank you.
Good afternoon. How are you? Do I need
Good
to
afternoon.
announce my name? No. Paul, you did. Thank you. Okay. So your question is the duration of time. It does vary. So obviously it varies on a couple of factors. One being the moment of time where the client is when they come into the program, when they're referred to JFS and therefore referred to provider. They have a college degree. They have a formalized education. They have a formalized or experienced work history. Those individuals are a little more easier to work through the process than those who come into the program with multiple barriers. So in the average timeline, it could vary from a couple months to perhaps over to a year. So it does vary. The second part of your question is the types of services, and we can expound a little bit more if you like for providers to give you more detail about that, but typically they revolve around a couple of aspects which are allowable under federal regulations. Some type of job search, job readiness preparation, job placement assistance, job training, occupational skills training, some type of vocational educational-based training, and then lastly, something we can talk about, what we refer to WEP, which is more of a work experience type opportunity, which is where individuals have an opportunity to go to a job site and work with an employer to get an idea of what the job is about and give that individual some true work experience that they can take later into their process as they move through the pipeline.
Okay. Thank you, Madam Chair.
One question for me. We noticed that there's different dollar amounts for each of the providers. So what is the differences between the two in terms of there's some additional programming that the Center for Families and Children may offer that Maximus doesn't?
They offer substantially similar programs. There are some differences between the two. I don't know if you can. That may be just the answer, but.
Yeah. So yes, so the differences, again, there are some allowable activities. I mentioned a few of them earlier that are under the federal guidelines or regulations which are allowed to put in place. We find that the Maximus Center tends to work a little bit more with job training, web assignments, where the model utilized by the centers tends to be a little more case management driven, and there's an influence more so on some occupational skills training as well as job readiness preparation. But I think to give you a really better understanding, I'll be happy to invite the providers up to give you an overview of what they do, to give you an idea exactly how different the two programs are.
Okay, and in terms of the case management, why, I would like whoever's from Maximus, why they don't offer that?
Well, I'm not suggesting they don't. It's a different type of model where one is really driven from a different perspective. One is more of a sort of a direct model, and the other is more of a case management heavy model. But again, they can provide a little more oversight as to exactly how detailed those two programs are.
You have the Maximus.
Sure. Maximus, pop up, please.
And if you could state how many were served in the program as well.
Hello, my name is Kia Mangrum, and I'm one of the project supervisors with Maximus. I'm actually representing on the behalf of our project director, Tierhouse Wabana. And I would like to take the opportunity to provide you guys a little write-up about what Maximus provides. So Maximus began providing services in 1975 with the mission of helping the government serve the people. We provide international and domestic government partners with innovative solutions from a global perspective that led to efficient and effective public programs and to improve the quality of life for at-risk population. To date, Maximus has operated welfare-to-work programs in more than 40 states and countries, like Italy, Sweden, and Singapore, for instance. Okay, so regarding our program overview, for the past 5 years, Maximus has partnered with the Department of Jobs and Family Services to successfully operate both the Ohio Work Experience and Ohio Propel programs, providing job readiness, subsidized employment, education and training, job placement services to both TANF and SNAP customers referred into our program. Our dedicated staff, which some were hired directly from our caseload, continues to leverage the power of collaboration and service integration to provide comprehensive services for customers and their families. Our employment and training services keep families at the center and focus of our goal setting, developing work maturity, promoting the benefits of education, and encouraging commitment to an identified career path. To date, we had 378 customers that have become job ready, and 64% of those have obtained employment. In addition, 218 customers were placed in positions making wages above the Ohio minimum wage of $8.80. The project also recognized 71% 180 days job retention rate for customers who are employed. Another noteworthy accomplishment is that 93 customers have earned their industry-recognized credentials in various fields, such as CDL, medical assistance, medical billing, coding, culinary, phlebotomy, electrical building trades, STNA, and IT. Okay, if I could, I would like to take a moment, if I have your permission, to share a few of our success stories.
Go ahead.
So, Ms. Stringer started attending the Maximus Ohio Propel program on July 7th, 2020. From the day that she actually started attending our career planning session, she actually impressed her case manager, or what we call career mentors at Maximus, by being both motivated, humorous, and conscientious. At the time of her referral, Mrs. Stringer had plans to work at home because she was pregnant. While completing her required hours monthly, Mrs. Stringer pursued her employment search and finally became employed on August 16th of 2020 with Arise Employment as a customer service representative. Throughout her time in the program, she communicated to the career mentor that she appreciated her professionalism and the support that the career mentor provided virtually. She also expressed she liked to work with people and would someday like to have the opportunity to be able to give back and motivate others that come through the program. So when we were recently looking to fill vacant career mentor positions at Maximus, one of our participants or clients, Mrs. Stringer, applied for a position working as a case manager. So officially on June 30th of 2021, Ms. Stringer was selected to be a part of our family. I had an opportunity to train her, and she is now officially one of our career mentors. I do have some other success stories. However, I want to ask your permission first, if you would like to hear more.
One more, please.
More? Okay.
One more.
All right. So Ms. Guerra is another one of our success stories who joined the program on November 30th of 2020. And she actually came through the intensive case management program. She has suffered severe depression due to extensive medical issues and had recently undergone a bone marrow transplant. While she was in our program, her intensive career mentor provided counseling and barrier removal techniques over the course of 3 months. In March of 2021, Ms. Guerra successfully gained employment at Tri-C, earning a wage of $22.74 per hour. And then finally, we have Mr. Dravinkumar. He came into our program on January 26, 2021. He had been laid off for several months due to the pandemic from a job that was a short-term assignment. Mr. Dravinkumar was a go-getter from day one. Okay, he consistently made all his monthly hours, and he participated in our job club. Though Mr. Dravinkumar was seasoned with several years of managerial and supervisor experience in the healthcare manufacturing field, he was struggling to regain employment. He continued to attend our weekly job share meetings with the Maximus Business Outreach team. And with constant support and encouragement from the business outreach team, on March 1st of 2021, Mr. Dravinkumar secured employment with Quava Pharma as a site quality systems manager, earning $64 an hour. Okay, his success comes from his perseverance coupled with the support that he was given by the Maximus team. He stated that he appreciated the constant follow-up, sincerity, and communication from the Maximus team.
Thank you. How many were served in that program?
In that program,
I do have some overall demographic numbers. So
Thank you.
for program year 21, we had, and by served, I mean those who actually were eligibilized by JFS were referred to one of our vendors and actually started. So they were 2016.
Okay, and that's just for the Maximus of,
No, no,
or
that's for
overall?
both providers,
Okay.
correct.
All right.
Certainly. So for the centers, it was 1,287, and for Maximus, it was 729.
Yes, Councilwoman Stevens.
Can I ask another question, please?
Yes, ma'am.
Ask a question, you interrupt,
so-
but if you have any more questions for the young lady, I can ask her to sit down. If not,
I don't know.
all right.
She might have a more precise answer than you. So we are, by the dollar amounts allocated for these contracts and then by the numbers that are generated, we're seeing a difference in the number of clients served. Why do we see a difference in the number of clients served?
Oh, so that's
Because they're both good programs.
oh, they're absolutely great programs, and there's a distinct difference from that. And again, the number I quoted to the numbers of people actually enrolled who started an activity. So our team, we have a specific team within JFS which services the work activity population for TANF and SNAP. We divided those groups into subsets. So one team specifically works with Maximus, and the other works with the centers. And so as we enroll and make individuals eligible and we determine whether their work require, a number of factors still have to take in place before they actually start. So what we determined that these flows take place where individuals come in, they're scheduled to an assignment and do not show up, or they start an assessment and do not show up, or they're sanctioned in the beginning because they missed the sanction because they missed an assessment process. So those things, although we tried to make sure that the process referrals were equitable, meaning that they're same number of sent everywhere, but we can't really control the population if they miss their assessment period or if they do not show up at the orientation.
Does the case management have an impact on that? Are we seeing, is the story, because there's case management with the Center for Families and Children, we have a higher level of participation later in the programming?
Well, again, just as I noted earlier, there's a level of case managers take place in both. They just have different approaches. But again, the number of enrolled is not necessarily those which are maintained and kept through the process. Those who are enrolled actually have gone through the eligibility process. So we see the drop-off prior, starting with the referrals. Starting with the provider. So I don't think their models have a whole lot to determine the number of people referred to them. I think, again, the process of determining someone work required and going through the assessment period and the orientation period where we see the significant drop-off, and that does have an impact.
Okay. I still can't figure out why, even though they're different models, why they're not more comparable, because they're both incredibly helpful.
Right, and again, I think we should look at the other more measurable numbers, such as the placement numbers and the retention numbers, because those are more equitable, because the numbers are reflective of those people they're working with. Again, our ability to refer, and again, our strategy was to divide the teams up so we have an equal number of staff. We're just sending the equal number of referrals. That was the theory, but in practicality and application, again, there are some bumps that do prevent that. And hypothetically, if we have 10 which are going to Group A and 10 going to Group B, we assume that 10 will start, 20 total, but if in Group A, if we have sanctions and we have missed assessments and missed orientations, that number could dwindle to 4 or 5. And that's where we see this disparity at that point.
So I'm trying to figure out whether you can now decide what kinds of things will tend to cause someone to drop out so you can assign them more fairly.
Yeah, and what we tend to do is if the individual is assessed by Group A and that group is assigned to, say, Maximus, for example, and they are sanctioned or they miss an appointment, a couple things have to happen. The individual has to go through the sanction process to become reengaged. So we find that using some type of behavioral modification and behavioral messaging shows that clients are more engaged, respond to that. But again, it goes to a pipeline. And we did see, and as the COVID virus sort of took place, and sort of took hold of our client base, many of them were more concerned about other key things, such as maintaining their safety of their family and not willing to be involved in activity because they were concerned about that. So that was more of an impact, which we had not much of a response to. Once we feel we can get the individuals enrolled and started the providers, we feel that their touch point is so significant that they tend to stay engaged at a greater rate. So when you look at our pipeline of service delivery, the greatest drop-off are those who prior to enrollment, prior to referral, they tend to stay more engaged once they're referred and activated by the provider. Hopefully that answers your question.
Are there any changes that you're thinking about making to increase the volume for
Well-
Maximus? Because it's not just Maximus. I want to see this number increase because all we hear from employers is that they don't have enough people.
Well, we hear that too, and I'm sure the providers and I'm sure the folks
They're
from,
telling us all the same
vendors
thing.
can say the same thing. And as I drive to the county, I see higher signs all over the place. So those are conversations we've had with our providers as well, that we're seeing these changes. We're seeing the employment community respond. We want bodies, so what can we do? So there are a number of things we're doing in terms of working with our providers to add some different components and different elements. This contract reflects something called subsidized employment. This new modification, we're also talking about changes in terms of in-home activities with their providers, so clients can actually be certified and stay in the home and be safer. So there are things we're trying to do in terms of operations that we can change to be a little more flexible to respond to the needs of the client. But in terms of the referral flow, we'll have to evaluate that to see if there's some things we can do in terms of increasing the numbers to one provider versus the other to level them out.
Okay.
Councilwoman Stevens, if I could additionally respond to that, thank you very much, Paul, for mentioning the modifications that we made as part of this amendment. I think as we discussed, looking at the RFP for next year in response to Councilman Miller's question, that's one of the things that we're going to look at, what's working and what's not working. But again, as part of this amendment, we went through a fairly detailed process with both vendors of trying to identify, here's how we pivoted during the pandemic. You guys were great at delivering services in an environment that nobody anticipated when we initially entered these contracts. Now we want to shift back more towards what we think the world might look like over the next year, but I don't think we consider that to be our end point. And we are looking at, incremental changes in these amendments, but that the new RFP that'll start July 1 of next year is really our best chance to apply some of these lessons learned. Because frankly, when we started these conversations several months ago, to get this amendment prepared, we were still very much right in the thick of the pandemic. I would say the picture has improved drastically in the 90 days since then. And even in the last couple of weeks, you hear more concerning things about, the emerging Delta variant and issues like that. Who knows how that's going to affect, the workforce over the course of the next 6 months or 9 months or through the duration of this contract. I think we're committed to taking a look at the lessons that we're learning now and making sure we put those in the next RFP.
Thank you. Thank you, Madam Chair.
Thank you. Can I ask how you sanction clients? You mentioned that you sanction clients.
Yes, so sanctioning is a standard operating practice that's required by federal as well as state policy. Sanctioning can come for a number of reasons. It can be applied for a number of reasons. It could be due to a misassessment, as I mentioned earlier. An assessment is basically the overview of the client and determination where they're going to go based on this determination. Another could be engagement within the provider, meaning they're assigned to an activity and they do not complete a certain number of hours or don't show up for the activity. So there's a whole process we have internally where we're able to actually tab and put a hold on the client services depending on what level of infraction they have. There are multiple tiers under the federal statute regarding sanctioning, and depending on what tier they fall under, there's a certain response to that, whether it's suspension of benefits for a period of time.
Okay, so, yeah, if you could just send those sanctions to us, we'd appreciate that.
And by those sanctions, you mean the actual breakdown of the process?
Yeah, I want to make sure no one's
or-
losing any resources or anything like that,
And so it is a vetted process, and maybe Director Gowan can give you a little more detail. So sanctions are not applied arbitrarily. They're applied based on actual a function. So again, a missed activity, missed assessment. So those are all things that the federal government requires to take place before we can take negative action on any case. So again, they're only done because something processes that or starts that process.
Yeah, I'm not concerned that, I am concerned that there are barriers to, I know people need to, not pay the price, but, reap some if they don't fill in with the contract. But I also know that there there are barriers to all kind of things, and I just want to make sure that we're being equitable and fair, and when we're making determinations for whether people eat or not.
And
So,
we certainly do that in Paul, or maybe Kevin mentioned earlier about a good cause process. And good cause is applied when a client does have a justification for missing an activity or missing an assessment, missing an event. And a good cause is collected by our staff, and they determine whether it is valid. At that point, negative action does not take place, and they give it a period of time to reengage.
and who makes that call for good cause?
So it is depending on the worker. So as I mentioned earlier, our work activities department, whether it's the Jobs Employment Training or our SNAP Employment Training department, one of the staff members will have to receive the validation from a client of good cause, and it will be a review by the supervisor or a center manager to make that determination whether it's appropriate or not.
So I just want to understand, because I think you kind of led me to believe that the numbers for maximum was lower than the Centers for Families and Children, based on individuals possibly not participating that were originally assigned to Maximus. Is that kind of?
Yeah, that's a theory. I mean, without really digging through the numbers to see exactly how many referred and look at them, that's a theory, and that's tend to be the most working positive theory. That's the one reason it's leading individuals from not starting and engaging. There are really no other reasons why, unless they decide to turn down the activity. But that seems to be the most logical explanation for the reason.
Open it up to my colleagues. Hearing none. All right. Mr. Porter, we need the second reading suspension.
Yes, thank you, Councilwoman Conwell. As I indicated in my earlier remarks, this was delayed due to kind of right-sizing the programs, if you will, as a result of us coming out of the pandemic and anticipating that, hopefully, knock on wood, this contract year is going to look a lot different than the July 1, 20 to June 30th, 21 contract year did. Those kind of back and forth negotiations and modifications delayed the appearance of these amendments. So we're asking if it could be approved at the August 3rd meeting, please.
Okay, and this is something that they send us invoices for? Okay.
Correct. We do get invoices on a monthly basis, Councilwoman.
Okay, so did we have any funds left in the last contract, or put aside for last year?
Yes, Councilwoman Conwell, it is anticipated that we do have funds remaining to carry over, and that factored into the amount of these amendments. We looked
So it's
at,
less.
what the utilization had been. So we're not saying like this is the overall amount that we expect them to invoice for over that 1 year period. If things kind of open up more as we anticipate, we would like to see some of those carryover funds, since this is the same contract, it's not a separate contract. We'd like to see those carryover funds utilized during year 3 of the program, since year 2 was such an odd year.
All right, and these are by, these funds will be utilized by new clients into the program, or some existing ones as well?
There may be some existing clients that would be served under these funds, Councilwoman, especially as we look at things like those retention metrics. It's entirely possible that, a client that we get an invoice for in September might have been referred to the program in May, for instance. We could conceivably, especially with some of the retention metrics, or if there's a client that gets one job and that job doesn't work out and they go back to Maximus or the centers for additional help with the placement, they could kind of, come back through that system again, so to speak. And our goal is to make sure that if those clients need help getting a job, that we help them get one that sticks.
Thank you. Hearing no additional questions, I'd like to move this to the full council. Second reading suspension. Can I have a second?
Second.
All right, moved by Conwell, seconded by Miller. All in favor, please say aye.
Aye.
Thank you.
Thank you.
Madam Clerk, if you could read the last item into the record, please.
Resolution 2021-0183, making awards to various providers in the total amount not to exceed $2 million for permanent supportive housing services to chronically homeless single adults and high-barrier homeless persons for the period July 1st, 2021 through June 30th, 2022. I'm sorry, for the various vendors listed on the agenda, A through G.
Good afternoon, Paul Porter, Health and Human Services, on behalf of the Office of Homeless Services. This is a set of contracts with vendors to support gap funding for permanent supportive housing. Council, as part of this year's budget, included additional funds for this service to help complement the federal funds that are available in this county for permanent supportive housing. An alternative procurement was approved by the Board of Control on April 26th, and that alternative procurement authorized us to seek out vendors that were already providing permanent supportive housing using federal funds, because vendors have to meet certain requirements from the federal government to provide this specific service. So the alternative procurement request was to kind of have a closed RFP, if you will, so only those qualified vendors that are already delivering this service using federal funds were eligible for the gap funding, which is, if I understand it, the intention of this funding being added to the budget to help kind of meet that need that the federal funds don't quite meet. Permanent supportive housing is meant to work with those who are experiencing the highest barriers to stabilization, including chronically homeless adults and homeless persons with high barriers to housing. And these services include rent-subsidized permanent housing, medical care, mental health, and recovery and employment services to help individuals integrate back into their communities. So it's part of the Housing First initiative, designed to help folks get housing before some of those other barriers have to be addressed, so that individuals have one less thing to worry about, that housing piece, which often has a ton of barriers. I'm joined by a couple of staff members from the Office of Homeless Services, including their director, Melissa Sirac, if you have program-related questions. As I mentioned, the alternative procurement was approved back on April 26th. We worked as quickly as we could to get an RFP out through that alternative procurement. We kind of did a truncated process where vendors had to submit a less complicated proposal in response to this alternative procurement compared to our RFP process, which is typically more lengthy and detailed. Part of that is we knew the vendors are already delivering this service. That's why we pursued the alternative procurement. I'm happy to answer any contract-related questions. And Melissa, I would invite you up at this point in case there's any programmatic questions.
Open it up to any of my colleagues.
Madam Chair.
Councilman Miller.
Have we seen an increase in the number of new homeless individuals in the county due to the pandemic? Or has the availability of various rent and housing assistance through the federal government enabled us to prevent such an increase?
Good afternoon, Council. Melissa Sirac, Director of the Office of Homeless Services. Councilman Miller, we have had some challenges throughout the pandemic on the permanent supportive housing realm, and of course, bringing individuals from unhoused to housed. And if I may, I just want to add, Paul, that was quite a thorough overview. I just want to say how grateful I am for the 6 providers that are before us today. They are the critical component in getting someone housed. And throughout the pandemic and its fluidity, we have opened 2 new permanent supportive housing buildings. I think I'd be remiss if that wasn't mentioned today, Harper's Point and St. Joseph's Commons. But even in the midst of that, we opened the buildings and the challenges we had in acquiring landlords. We've attempted to provide landlord incentives. And of course, the eviction moratorium has also played a piece in available, affordable, quality housing.
And Madam Chair, Director, Is the eviction moratorium still scheduled to end on July 31st? And if so, what impacts are you expecting after that date?
Councilman Miller, it is expected to be lifted at that time. We do, of course, have great concern, I do myself, for the whole continuum and what that would mean, not only for those seeking housing, but for our shelters as well. Conversations have started with legal aid as well as Cleveland Housing Network, Cleveland Mediation Center, and our office, in talking with local government at what else we can do to manage the eviction process going forward. So not continuing the moratorium, but can we perhaps put some pre-filing requirements in place that would at least manage that process and prevent an influx coming into our system? And also open up the resources that are well within our community that landlords could take advantage of and keep that person housed.
I'd like to follow up on a couple of questions that
Yes.
my colleague asked. The numbers. Pre-pandemic, how many people did we average come through the system? Because we know that there are people who don't go through the system that are homeless.
For single adults?
Yes.
I don't have those exact numbers with me.
Could you ballpark them for me?
I have OHS staff member Nick Bettina. That might be something he'd be able to do if we could loop back around to that. Sure, yeah, yeah.
Oh,
You don't
he's
mind
looking-
giving him a moment?
He's looking in the phone.
He's actually, sorry.
And while he's looking, could he
Yes.
tell us what you saw through the first portion of the pandemic, so year end 2020? Because I understand your numbers are still fluid for 2021.
In the realm of permanent supportive housing or just across our whole system?
Across your system.
Oh, goodness, it's such a blur. So we continued our initial initiatives with our immediate crisis response to the pandemic. We have kept the shelters deconcentrated by 50%, and that was using alternative shelter methods in the form of hotels. That's continued on. In the meantime, we've continued, it has been challenging at times to continue the case management that's provided to get someone housed. It's important to note that anyone that went to those alternative shelter locations, their housing plans remained in place. And then, of course, the critical component of being housed, working through how do you provide those services during the pandemic. So, of course, there were always people still on the ground, but as you do assess the housing and you do the housing applications, these providers would know best if you'd like exact detail, but they modified their services to ensure that applications were still being processed, homes were still being approved, and people were housed.
So how many permanent units do we have in Cuyahoga County right now?
So amongst these 6 providers, we have 884. And thus far to date, in 2020, they've served 895 unduplicated individuals.
And you opened 2 additional PSHs?
They sure did.
And how many units are in those buildings?
There is 68 in St. Joseph's Commons and 70 in Harpers Point. 71. I knew it was 70.
So you almost had a 20% increase
Yes.
with quick bad math.
That's the only math I can do, Councilwoman.
So we know that there's a continuing need to move people from the streets and shelters into PSHs. So who are you working with to increase, because it takes 2 years at a minimum to get new units opened. Are you working with more of the same providers, or what are we doing?
We're
What's our
open to
plan?
working with all providers, but I'm definitely using the experts, such as those that are in the room today. And as we enter our recovery efforts and our permanent plans from COVID, I mentioned earlier this morning to some of council, non-congregate shelter is one of our initiatives, but really housing is the other arm. We have a severe lack of housing and not having enough available units or landlord pool to work with. So that is definitely a priority of our office and the continuums, as well as how can we creatively provide housing in the meantime while we hopefully have, the federal dollars and additional resources to support the opening of new buildings.
So in your continuum plan, I believe that's the correct phrase. If you could wave a magic wand, what did you say you'd like to bring on board as far as the number of housing per year? Because we know we have this huge shortage of affordable housing, let alone the transitional piece from the street to permanent shelter and then getting them to the wraparound services so that they can have an apartment or a home of their own.
Without having an exact number in mind, to be honest, Councilwoman, I think a lot of it depends on funding, and it depends on how we house these individuals. So permanent supportive housing is one method. I would say that the continuum is also discussing other methods of housing. Other areas have been creative during the pandemic, such as tiny homes. They've also talked about leasing out whole buildings and doing a master lease, which eventually the individuals take over. So I imagine that down the road, it'd be a composite of all of that.
And if, for example, for 2025, what would you like to see come on board, since you had 138 or something like that come on board?
We're close to ending chronic homelessness. I would like to see us have enough units to do that. I'd also like to see the unsheltered be housed, and in addition to that, non-congregate shelter. That's where I imagine we'd be sitting.
How many more units are we looking at to do that?
I don't have an exact number off.
So I'm a data geek, and
Okay.
I always want to know, so you're going to be back here.
I am,
Come
and I
with-
can get you that number.
Come with numbers.
I can.
Do we have an answer from the team?
I was going to open it up to the others, if I may, as well. Anything that they wanted to add?
If I'm remembering correctly, former director Gillette, it wasn't that many. I want to say it was under 200.
Okay.
They can see if that's changed since the pandemic.
That's the real question. Are we seeing a larger number?
This year, in 2021.
We're going to see a large number on July 31st.
With evictions, yeah, I believe so.
Councilwoman, if I may, from March of 2020 until March of this past year, 4,373 individuals entered our system.
That's an increase.
Slight increase.
Thank you. Madam Chair, that gets it for me.
Councilman Sweeney.
Thank you, Madam Chairman. To my colleagues that ask for your patience, it's a point of personal privilege just to recognize Front Steps there in my district and the wonderful work Sherry Brandon, the CEO, does. I think she's in the room. And my old dear friend, Jana Yanalifo, from my days over in Famicos. Keep up the great work. And the other 4 entities, I look forward to getting a relationship built with you and trying to play my role. Thank you very much, Madam Chairwoman.
Seeing no other questions, Director, would you or Mr. Porter, you need this in the second reading suspension? I would imagine.
Councilwoman Conwell, yes, if we could please get second reading suspension for this due to the 7/1 start date. And I do want to stress, I think I mentioned multiple contracts before. The new contract management system assigns a separate contract number to each vendor, but this is a master agreement. So the same as the one for Division of Children and Family Services. If we find that, one entity provides more beds than what they're allocated for here, we do have the flexibility to move those funds around, and this contract will be paid based on invoices from the vendors. These aren't necessarily fixed amounts. They're not to exceed amounts.
And I just want to briefly, after the meeting, meet whoever came from a Melody of Mary Housing and YWCA of Greater Cleveland, Independence Place. I don't think I know those. Okay?
And if you have individual questions, Councilwoman Conwell, all of the vendors from this program are represented here today. So if there's a desire to hear from specific vendors on the record, okay.
All right. So we will move this, I will ask for a motion to move this to the full council under second reading suspension.
So move, Sweeney.
Second.
All in favor, please say aye.
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 Thank you. It's been moved and seconded. All right. Hearing nothing from anyone else, any miscellaneous business from my colleagues? Hearing none, seeing none.